kwa sasa anazungumza kupitia mtandao wa YouTube akiwa katika ikulu ya rais, na anazungumza na baadhi ya wale wagonjwa ambao wamefanikiwa kupona kutokana na virusi vya korona wakiwa katika jumba la afya. Hebu tusikilize yanayojiri kwa sasa.
On December 19th, so I landed in Texas, and then when I finished my stay there, I took a flight from Cleveland in Ohio. Then I went to Chicago, and I had a 10-hour layover there where I had some interactions with certain people, and then from there I took a flight to London. So from London is when I think I may have contracted the virus in London or on the plane back to Nairobi. So after landing in the country, I had a cough 3 days into landing in the country. So when I suspected they might have been something, as a responsible Kenyan citizen and a patriotic Kenyan, I decided to watch the response of my body for 1 day. And then the next day, that is when I presented myself to Mbagathi Hospital, because I saw on when I was in the US, I had seen something about Mbagathi Hospital having an isolation center. That's why I went to Mbagathi. So I think that was very useful, the information I saw, because at least it helped me know where to start. So Mbagathi, I would like to thank the staff that I met there, because they took me seriously and they gave me the mask. Immediately I mentioned that I had gone abroad and I was having a cough, and then they took it seriously. So I went into quarantine for the past 23 days. I have been in quarantine and I've been receiving proper treatment, and I would like to be very thankful to Kenyatta National Hospital and the nurses. It was not an easy thing to do, I know, because the nurses were also, I think they were also, you know, under some pressure because it's the first patient, they have not seen this before, but they were really nice. They were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable, and sometimes you may show very, very mild symptoms, just a cough and a headache, but when you see that, you're supposed, you know, as a responsible Kenyan citizen, you should contact the authorities and tell them, I'm not feeling well, this is how I'm feeling, and be, you know, come forward and be confident, because they're going to treat you and they're going to do everything for you. So that's all I have to say. Thank you very much.
Thank you. Yeah. Thank you, Brenda. Thank you, Brenda. Brian.
Yes, for me, I got the virus from contact with Brenda over here. She imported it, and then I think I got it from the community transmission, what the ministry is calling that. So immediately, Brenda's results came back. I'd like to thank the government, your government, because they reacted very fast. They came for me wherever I was. They took me to a government facility, and I was tested, and immediately the results came back as positive. The government, your government again, embarked on treating me for the past 2 weeks or so. And as a result of that treatment, I've recovered. I'm feeling much, much better now, like I was before. So, yeah, that's all I have to say, really. What I'd like to tell other Kenyans, okay, I was speaking to an aunt of mine from up country yesterday, and she was telling me the fact that her niece, her nephew, me, had the coronavirus. At least she can believe that it's something real and that it's in Kenya, because so many people up country especially do not believe that corona is real. But I want to tell them that it's something that's in Kenya right now, and they have to take the necessary precautions and just follow what the government is telling them at all times. Yes, thank you.
Thank you very much, Brian. Thank you very much, Brian. We appreciate that, as we appreciate you, Brenda. And let me just, in conclusion, just say, we are all very proud of both of you. We are thankful to God that you have managed to go through treatment and you are now well, able to go about your businesses once again and continue with your lives. But once again, to appeal to all Kenyans, we can overcome. Let us not be scared to say if we are not well. Let us isolate ourselves. When we talk about social distancing, it's not a joke. It's not a joke, especially for those who know they are not feeling well. Let us keep away and avoid spreading this deadly disease. And those of us who have it, those of us who are feeling unwell, let us follow the example of these two wonderful Kenyans who have shown us that you can come forward, you can isolate yourself, and ultimately you can be treated and recover from this deadly virus. Fellow Kenyans, the government has taken measures. We may, as circumstances unfold, be forced to take even more measures. But let us all understand that these measures are all aimed at protecting life and keeping Kenyans safe. Let us work together. Let us abide by the guidelines and protocols set out by the Ministry of Health. And let us continue working together until we overcome this challenge. Brenda and Brian, thank you. Waziri, make sure over the next few days, as you release them, bring them over to me. I want to meet them myself in person, not over a camera. I want to assure Kenyans that this is a disease, yes, that if treated can be overcome. I'm looking forward to seeing you guys soon.
We're looking forward.
God bless you all.
Thank you, sir.
Asanteni sana.
Na bila shaka ni taarifa ya kutia moyo hapo, wakati ambapo taifa na dunia mzima inapambana na virusi vya COVID-19. Wakenya wawili hapo wakizungumza kwa njia ya mtandao moja kwa moja na Rais Uhuru Kenyatta. Ni Wakenya ambao walikuwa wanaugua virusi vya COVID-19 ama virusi vya corona, lakini Mola kawajalia na kwa sasa wamefanikiwa kupona, na basi wakati wote watakuwa wanaruhusiwa kuelekea manyumbani mwao. Rais Uhuru Kenyatta hapo akisema itakuwa fursa nzuri yeye kukutana na wao moja kwa moja ili aweze kuhakikishia Wakenya kwamba ndio ni janga la kitaifa, lakini vile vile ni janga ambalo kwa pamoja tunapofuata maagizo ambayo yanahitajika ama maagizo ambayo yametolewa na serikali, basi tuna